to my valued viewers and subscribers. Welcome back to my channel, Health Tips 23, where health is always the focus and will remain the focus. Today, I will be looking at some special cases in pregnancy. And, of course, two main areas that I'll be looking at is one, elderly primary gravida, and two, grand multipara. A primary gravida is a woman who is having her baby for the first time, getting pregnant for the first time. The elderly primary gravida is, for some countries, it's a woman who is getting pregnant for the first time over the age of 35 or 35 and over. And for some, it's 30 and over. There are some possible complications that are normally associated with the elderly primary gravida. And of course, for the elderly primary gravida, I normally see those babies as precious babies. That's what I always see. Not saying that the other babies are not important, but that's how I always refer to these moms when they are pregnant. Right. You want them to feel comfortable after waiting so long to get pregnant. Well, some might have been trying and it never worked. And some, yes, they'd say, well, then, yes, this is the time when I'm ready for it now. So, you have to let them feel welcome. All right. There are some possible complications that are normally associated with the elderly primate. And one, tendency to abort the baby. And just want you to understand what I'm saying when I'm saying tendency to abort. I don't mean that the mother is trying to do it, but sometimes it's a possibility that they might just lose the baby then. So that's it. All right, there's a high incidence of increased blood pressure, preeclampsia and eclampsia. We refer to all three are associated with high blood pressure. So the eclampsia is just the different stages. Right, because the eclampsia is really having a seizure attack, and preeclampsia is a sign that eclampsia is imminent. That means it's a sign that this lady might go into seizures due to eclampsia. Right, and of course these are caused by the high blood pressure. Right, so there's a high incidence for those. Long period of infertility might cause uterine fibroids. And if this develop, it may complicate the pregnancy. If the mom has uterine fibroids, it might complicate the pregnancy. There's a saying that goes, if you don't use it, you will lose it. And that is what is happening here. Because yes, you're waiting and the uterus is there, one ready to receive a baby, didn't get it. And because he didn't get it, then it just decide to this fibroid just decide to occupy the space, right? So with this now, it makes pregnancy a little harder for the mother, because she could be it could be that she might get pregnant and she might just abort it. She might just keep aborting, or she just abort it, and sometimes she might not even know what is happening there, you know. And at the same time, if the fibroid is there, then it's like a competition between the baby and the fibroid, because the fibroid is there pushing the baby, and it's like one pushing the other. So if you're understanding what I'm saying, the one is trying to press on one. So with this now, the baby is at risk and the mother will feel a lot of pain. I've seen, I've experienced a lady in hospital. Well, she was a elderly lady. I think it's the first I've seen someone that age, being pregnant, and she was like 50. And what happened? She had she had her son, the last son. I think the son was 18, and she had been trying and she didn't get pregnant, so she counted all off to say, well, yes, that's it, until she didn't even know she was pregnant until when it reached some months. And then she was in hospital. She spent a long time in hospital because of the fibroid, because the fibroid was there, and she was having a rough time with it. So it can be a challenge. So all right, so labor is longer. The labor is longer in the elderly primate than in the multipara. Um, Posterior position of the occiput are common. Alright. The occiput is at the back of the head. And with delivery, normally the baby is the occiput is normally anterior to the perineum. So when during delivery. So we do that now. That means with anterior, with the occiput anterior, then the birth of the baby, the head is down. So the back of the head is up and the face is down. But with the occiput posterior, then would be a face presentation, because the baby would be delivering face up instead of face down. So that's that with just to explain the possibility of the posterior position with the occiput. The multipara might have the elderly primate will have abnormal uterine contraction. Yes, and this can also complicate the labor, right? Because labor is a process. It goes by stages, different stages, and the uterus must be in. It takes the it takes the uterine effort as well as the maternal effort. The maternal, the fetal, and the uterus in order to get the baby out. So if the uterus is unable to contract to push out that baby, then of course, labor is going to be prolonged, right? And a complication might be there because the longer the labor is, the higher the risk of the baby coming out with complication. All right, you have rigid perineum, and the perineum is that section between the vagina and the anus. And for the baby to come out, the perineum have to be able to stretch to get out that baby. So with it being rigid, problem there. They might have to perform episiotomy in order to, and the episiotomy is just a little slit on the perineum in order to get the baby out, opening the area to get out the baby. All right. You have a higher risk of neonatal mortality and morbidity with the elderly primate, due to prolonged labor. Like I've said before, prolonged labor, the baby is there, delivery is being prolonged, baby is losing oxygen, and then the oxygen supply go low, then the brain is damaged, and then you might have come up with palsies, cerebral palsy and things like those, where the baby can become vegetable, if not demise. It can become vegetable, right? And so the morbidity is when the baby might end up with paralysis or things like that. And the mortality is if the baby comes out dead or dead post delivery. So that's how the mortality and the morbidity comes. Alright, there's a high incidence of congenital fetal abnormalities associated with the elderly primate, like the Mongolism, or Down syndrome, what we call Down syndrome. Right, you have the hydrocephaly, where with the hydrocephaly, the head is large, that it cannot be delivered vaginally. It has to be a cesarean section. And anencephaly, where with the anencephaly, you have the upper part of the skull, the baby might have no brain, underdeveloped brain, right? And the skull might incomplete. So you have the baby with the head top is flat, the flat instead of the usual size. Yeah, the face is alright, but the head is flat. So that is the anencephaly. Brain is underdeveloped, and the head skull is incomplete. Alright. That is, of course, it's a neural tube defect. And those are some of the reasons why when they come to the 6-week clinic, we give, sorry, not 6 week, when they come to the antenatal clinic, they are given, you have, they give, a vitamin. Oh, I don't remember the name of the vitamin that it normally gives. I still remember that they normally gives to the mother. And of course, there's also maternal morbidity and mortality, because the mother can develop complication where she might not be able to move again how she would love to. And of course, she can you can have maternal death, not trying to scare, but you know, those are some of the complications. And the maternal morbidity and mortality, they say, is higher in the elderly primate than the multigravida. And it is in the elderly primate and the young primate than the young primate and the multigravida. Therefore, the midwife must refer a elderly primate to the hospital for delivery. These ladies must be delivered in a hospital that has and is not just a little maternity hospital. It has to be a big hospital where there is theater, a pediatric unit, nursery, all those pediatrician, all of those things. So eh, important to refer them to um to the hospital. All right. That is that for and for the anencephaly, it's a change in the genes of chromosomes. The genes are chromosomes. Right. All right. So now we look at the grand multipara. And the grand multipara is a patient who has had 5 or more viable babies. Again, some other countries will say 7 or more viable baby. All right. The complications that normally associated with these babies, with these ladies, are the high risks for hypertension and other cardiovascular condition because of the advancing age. Anemia is most of the time is present, and this is due to the successive pregnancy where you keep having the babies and there's no rest between pregnancies, so you don't have any time for your body to get back to where it was, or to so anemia will be there. And of course, most times these ladies who have a lot of children, sometimes the fund is not really there to cope with eating the way you want, because a lot of mouth to feed, so that will happen. And sometimes the ladies might have anemia from previous pregnancy. So the pregnancy before you was anemic, and then because you get pregnant so quick, get pregnant again, so you're carrying back over the anemia from that one to this pregnancy. Because with every pregnancy, there's a risk of being anemic, because remember, whatever you consume to supply the body with iron, it is being shared between you and the baby. So, that happen, and then you have that baby, hemoglobin level low, and the anemia is there, and then you with this baby now, pregnant with this baby again, so quick, never have a time for to come back. Yes. Deficiency of iron, folic acid, and vitamins are most times seen with patients with large family who are unable to eat right. And like going back to going back to what I was saying about the neural tube defect, folic acid was the supplement that you normally give to help with those. All right. Poor health due to anemia and poor living condition most of the time, another family worries while caring for a child. Yes. So, with the anemia, the health of the mother is compromised. And yes, and sometimes the living condition, because for instance, you're having a lot of children, sometimes the living condition is not good because more people than space, so overcrowding and all of that. And you have had a family problem too, where this one might sick, say one of the babies sick, you have to be in the hospital with this child for, say the child have diarrhea, you have to be in the hospital with this child, and then after you leave hospital now, and just as this child is ready to go home, remember those that you leave at home sometimes, nobody is there to really give them the care that you would have been giving them, seeing that the mother, as the mom, because nobody can, no matter what the person's socioeconomic status is, no one can look after your child the way how you would look after your child, no matter how. you know you have you within yourself, there's no one that is going to take care of my child the way how I am taking care of the child. So back home, going back to and fro from the hospital, you don't know what is happening at home. And then sometimes as soon as you go back home with this baby, then there's another one to go. Or while you're there, one sick and the worries continue and continue. So sometimes those are some of the problems that the mother might encounter. All right. All right. The mother might increase weight due to frequent deliveries, and this overstretching of the abdomen leads to the abdominal muscles become laxed. Right. The elasticity is not there because with every pregnancy, then there is more, the uterus has to stretch to facilitate that baby. So with the more she gets pregnant, is the more the abdominal muscle become lax because with the frequent stretching. Alright, then um resulting, so right, another complication that can result because of the laxity of the uterus is malpresentation. So because the uterus is like the shape of your hand, right? And despite it's like that, when the baby goes in, and even if it's a 10-pound baby, the baby is going to stretch, the uterus is going to stretch to facilitate that baby, that growing baby. So with this now, every time and every time and every time, and the muscle gone and it's there. So the baby has enough space in the uterus to turn and to turn and to turn. So most times the baby is either oblique, you have malpresentation occurring, where the baby might turn transverse, what you would call crossway, right across the tummy. That's the transverse. Or the baby might turn slant, which would be an oblique line. Which way the right position for that child, for that baby, would be cephalic. The head should be down. But because the baby has enough space to turn and turn and turn, the baby end up having a malpresentation. So that again is another risk. There's a risk for multiple pregnancy. They say there's a higher risk for multiple pregnancy in the grand multipara than the woman with a lower parity. Alright. Antepartum hemorrhage. There is a risk for antepartum hemorrhage, postpartum hemorrhage, and concealed accidental hemorrhage. So antepartum hemorrhage is before the lady have baby. Is a risk of her having some sort of bleeding. And of course, that's not normal. So that is hospitalization. All right. And also with postpartum hemorrhage is after the birth of the baby. Then when they after the placenta is delivered, then she might have bleeding. And postpartum hemorrhage just don't only last in the hospital until while you're in the hospital. It can go on for weeks after bleed. You can have bleeding for weeks after, and then that would be, if it occurs anytime after, then you know that is still postpartum. It's still classified as postpartum hemorrhage. Alright. It can be concealed accidental hemorrhage where a little bleeding might be going on inside, but it's not. It doesn't come out. Like there might be probably some like a detachment of the placenta inside. So it is detached, but it's hidden there. It's not out. Alright, so with that, um it would be still be a complication. Alright. For the grand multiplier, they are they have the risk of having complication during labor. And one is precipitate labor. And precipitate labor is just that the lady she might just be having a little pain. And as soon and she feels as if she start having pain, and she rush into the delivery room, and then the baby just come out quick. That is precipitate labor. Cause labor goes by stages, and it takes time, and it varies between the parity of the person. Right. You can have a prolapse of the umbilical cord due to a transverse line, and and with the and premature rupture of the membranes, because the baby stretching on the inside, and the rotating and pulling on the cord. So so yes. Yeah, the umbilical cord prolapse is if most time this occur if like the membrane rupture, and when the membrane rupture, the cord comes down, and with that, that is um that is an emergency, because if the cord prolapse and the baby goes, say the baby is cephalic and the head goes down on it, and cord compression, then of course it can cut off the supply of oxygen to the baby, and then the baby life will be in danger. All right. There can also be ruptured uterus. Yeah, because the uterus is already thin because it has been used for quite some time. So it can be very thin. So with this, the muscles are not that um strong. So with this now, um they can it can cause rupture of the uterus. Alright. You can also have obstructive labor due to face presentation, occipito-posterior position, and shoulder presentation. So those are some of the ways that the baby can come out. Instead of coming out cephalic, it can come out shoulder. They can have shoulder presentation, and with that it's dangerous because the baby you can the baby can damage during the delivery. And you have the face presentation too, like I said before, which the normal presentation is the normal presentation is occipito anterior and not occipito posterior, right? So with the occipito posterior, the face is going to present. With the occipito anterior, the head is down. The face is going to be down. All right. Also, you could have postpartum hemorrhage due to retained placenta or rupture of the uterus. Yes, because the uterus cannot contract. The retraction of the uterus is not good, so you can have a ruptured uterus, and retained placenta. Postpartum hemorrhage is due to retained placenta. So with this person now, you have to make sure that she's monitored very, very closely in order to prevent some of these complications. Yeah, because the postpartum hemorrhage, yeah, a postpartum hemorrhage with a person who have frequent pregnancies and iron and being anemic, and most time they are anemic. Of course, say transfusion have to be transfused, so you have to make sure say the blood is there ready, that in case an emergency, then it is given. Going to hospital, the first thing you have to do after examining that lady is to make sure you give her an IV access. That means if any emergency, you have to run in the fluid, so and with a ruptured uterus, the only thing that they once the uterus is ruptured and she bleeding and she bleeding and she bleeding, the only thing that can solve the problem is surgery. And most of the time is the uterus cannot be saved again. Most of the time you have to do you have to do an hysterectomy in order to really stop the bleeding. So it's best if you take it out other than allow the lady to be there and then she would bleed to death. So first thing you have to look at hysterectomy. Get rid of the uterus and let that lady live. Happily ever after. Okay, so that is that. We looked at the elderly primate and we look at the complication that can occur and we look at the grand multipara and the complication that can occur and the treatment that can be given to these people while they are pregnant, during delivery, and after delivery. So you know, say these ladies have to follow them up closely. Yes, and you have to encourage them, give them psychological support, encourage them during the pregnancy, encourage them during labor, and postnatally, you have to be there for them. All right. Thank you for watching. And I said, please remember to like my channel, subscribe, and share. Until next time, I'm out.